How did one family build a pharmaceutical empire that killed more Americans than any war? The question hangs in the darkness, as unsettling as the answer. The Sacklers were not gangsters or cartels. They were doctors, businessmen, and philanthropists. But their drug empire left a trail of death across the country. OxyContin was their miracle cure. It became a national curse. This is the story how one family made billions while a nation bled from the inside out. Hey, I'm Richard. I dive into wild true crime stories, from arms dealers to massive art heists. If that sounds like your kind of thing, feel free to subscribe. But now, let's get into today's story. For years, the Sackler family looked like heroes. They gave millions to art museums, science labs, and cultural centers from New York to London. Their name was everywhere, on buildings, plaques, and walls, seen as a symbol of wealth, education, and class. But behind the fancy donations was something much darker. The Sacklers owned Purdue Pharma, the company that made OxyContin, a powerful painkiller approved in the 1990s. It didn't just treat pain. It started an addiction crisis that ruined millions of lives. What looked like generosity was really built on suffering. The Sacklers' fortune was built on this drug. Publicly, the family donated millions. Privately, they reaped billions from a pill they promoted as a medical breakthrough. In the late 90s, Purdue Pharma introduced OxyContin as a miracle pain medication, an extended-release form of oxycodone. It was marketed as safe, effective, and non-addictive, perhaps the biggest lie in modern medical history. Purdue's advertisements and sales reps assured doctors that OxyContin had a low risk of abuse,
much less than 1%.
They claimed. These numbers were not based on science, but deception. In truth, OxyContin was a narcotic twice as potent as morphine. Yet, Purdue obscured its dangers. Internal strategy memos even noted it was extremely dangerous to let doctors know how strong and addictive OxyContin really was. For a time, the deception worked perfectly. Doctors believed they were helping patients in pain, unaware they were prescribing a highly addictive drug that would feed a nationwide dependency. From its headquarters in Stamford, Connecticut, Purdue Pharma became the corporate heart of the Sacklers' opioid empire. From there, OxyContin was promoted across the entire United States. From the beginning, Purdue Pharma pursued profit with ruthless zeal. The company pushed OxyContin to physicians, hospitals, and even the general public as a safe, low-risk solution for pain. Sales representatives became the soldiers of this campaign. Purdue expanded its sales force and rewarded them with massive bonuses to push OxyContin prescriptions at all costs. They showered doctors with brochures, free dinners, all expenses paid conferences, and even coupons for free initial prescriptions. In rural areas and small towns, Purdue's salespeople descended like locusts, saturating entire communities with OxyContin promotions. Internal training taught them a single mantra.
Less than 1% of patients taking opioids actually become addicted.
Purdue cited a flimsy 1980 letter, not even a real study, to falsely assure doctors that addiction was rare. They also promoted the concept of pseudo-addiction, telling doctors that if patients showed signs of craving, it was actually unrelieved pain, meaning they needed even more opioids. This idea created a vicious cycle that turned patients into lifelong dependence. Purdue paid influential doctors on its payroll to give lectures that praised OxyContin's benefits and downplayed its risks. They funded advocacy groups that demanded more aggressive pain treatment, which only meant more opioids. Misleading charts and fake studies were circulated to convince physicians that OxyContin was different, a slow-release miracle that was supposedly less addictive. In reality, the drug's effects often faded early, causing withdrawal between doses. Purdue's answer was not to fix the drug, but
tell doctors to raise the dosage.
The result was dangerously high opioid levels in patients who thought they were being healed. Purdue targeted vulnerable communities first: mining towns, farming regions, factory districts, where injury and pain were common. By the year 2000, some Appalachian towns were writing OxyContin prescriptions at 5 times the national average. Sales reps focused on high-value prescribers, those writing the most opioid scripts, often in isolated towns with little oversight. Everything was done to maximize sales, and it worked. OxyContin revenue exploded, from $48 million in 1996 to over $1 billion just 4 years later. At the launch party, Richard Sackler, the founder's son, predicted a blizzard of prescriptions that would bury the competition. That single phrase captured the family's mindset: a snowstorm of OxyContin that would cover America. By the early 2000s, the storm had arrived. Reports poured in of OxyContin being crushed, snorted, or injected. Patients who began with legitimate pain prescriptions became trapped in addiction. When their pills ran out, they turned to the streets or switched to heroin. Rural communities across the United States began to collapse under the weight of opioid abuse. In Appalachia, once thriving towns were gutted by crime and despair, OxyContin became known as hillbilly heroin. Overdose deaths surged relentlessly. Between 1999 and 2019, more than 500,000 opioid overdoses. More than all U.S. soldiers killed in World War II, Vietnam, Iraq, and Afghanistan combined. At the height of the epidemic, more than 100 people were dying from opioid overdoses every single day. Communities called it a plague. While addiction spread, the Sacklers remained hidden behind philanthropy. They continued to fund museum wings and university halls, buying moral cover for their fortune. Prestigious institutions stayed silent about where the money came from. Inside Purdue, the truth was known. By 1999, executives were aware of OxyContin abuse. They saw reports of stolen pills of patients, doctor shopping of overdose clusters, but instead of acting, they chose denial. Richard Sackler wrote that the company needed to hammer on the abusers in every way possible, calling them the culprits and the problem. Addicts were blamed as criminals, while the company portrayed itself as innocent. Purdue's public message was that misuse was the fault of reckless individuals. It introduced a reformulated OxyContin pill in 2010, claiming it was abuse-resistant, creating a hardened tablet that was harder to crush or dissolve for snorting or injection. But users simply shifted to heroin, and later, to fentanyl. The human toll was beyond measure. Families were torn apart, children left orphaned, and towns reduced to ghosts. Victims' parents began demanding answers and justice. Protesters filled the halls of museums, carrying mock OxyContin bottles labeled "Prescribed to you by the Sackler family." Their chant echoed across the world, "Sacklers lie, people die." The family's respectability was crumbling. It took years for the law to catch up, but investigations and lawsuits began uncovering the truth. Internal emails and documents showed that Purdue knew OxyContin was addictive from the very start. They also showed the strategy, blame the addicts and keep the doctors prescribing. The first cracks started to show. In 2001, the Attorney General of Connecticut urged Purdue to take action regarding OxyContin abuse. In 2004, West Virginia sued Purdue for deceptive marketing. The state claimed OxyContin wore off too early and that Purdue could have tested an 8-hour formula, but chose not to. Purdue paid $10 million to settle, and the evidence remained sealed. Then came the public collapse. In 2007, Purdue Pharma pleaded guilty to felony misbranding of OxyContin. The company admitted it marketed the drug as safer and less addictive than it was. Purdue and 3 executives paid $634 million in fines. No one went to prison, as shocking as it sounds. The Sacklers were untouched. For the company, it was just a small cost of doing business. Still, the strategy continued. Soon after, Purdue brought in McKinsey & Company to turbocharge sales again. They once more targeted top prescribers and devised tactics to evade regulations. The lawsuits kept coming. In 2015, Kentucky settled for $24 million after nearly a decade. In 2017, Everett, Washington sued Purdue for ignoring suspicious sales patterns and failing to alert the DEA. By 2019, more than 1,000 lawsuits had been filed against Purdue Pharma. States demanded billions in damages. That same year, Purdue settled its first major case in Oklahoma for $270 million, then filed for bankruptcy. The Sacklers offered $4.5 billion in exchange for legal immunity, a way to buy freedom without admitting guilt. An audit later showed the family had already taken out more than $10 billion from the company. In 2020, Purdue pleaded guilty again to federal crimes and agreed to pay $4 billion more in fines. Still, no Sackler was charged. By 2023, their name was being stripped from museums and universities worldwide. The Met, Harvard, the Louvre all erased it. When told 59 people had died from OxyContin in one state, Richard Sackler wrote, "This is not too bad. It could have been far worse."
Did you remember to subscribe?